Hey y'all,
Hey y'all.
What's up? This is El Presidente.
this is
You
your boy, gospel icon, my Harold Peoples Jr.
It's Lady, also known as Leah, and you're now watching.
And you're listening to Speaking Plain
in
English.
the speaking plain English with your host Roberta
Share
on
your beautiful hostess, Roberta Johnson.
With my homegirl, Roberta, on Praise.fm.
On Praise FM.
on Praise FM.
Hey, y'all. Happy Saturday. I'm sorry, that's a groove. I don't know about y'all, but that always gets me going in the very beginning. The very beginning, I absolutely love it. So, again, happy Saturday. Welcome to another episode of Speaking Plain English. I am your host, Roberta, and I am so excited for our guest today. But before we get into that, yes, we got to do all the preliminaries. I'm going to ask you guys to do all of your wonderful media stuff, the liking and the sharing and the subscribing, and tag a couple of people, especially those who are kind of sketchy or skeptical a bit about the medical field. There's a reason why I want y'all to listen to what I got to say, or what, not just what I have to say, but what our guest has to say. And before I bring her on and do her bio, I just want to remind you guys that in the event that you are a Black author, Black artist, or a Black business owner, and you would like to be a guest on the show, you can always feel free to reach out. If you need any ads, or if you have an event or a shout out or a birthday, or anything like that that you want to announce on the show, I am going to ask you to send that to me as well, at least the Tuesday before the week that you want it aired, and that way we can fix it up nice for you and get it together. All right, so I do not have any birthdays that I know of this week, or Earth Entry anniversaries as I call them. But if you do, then you can put them in the comments so that we can, say happy birthday or happy Earth Entry anniversary to them. Like I said, I'm working on something special. So just stay tuned, stay tuned. All righty, so before we get started, before I bring my guest out, I'm going to read her bio. And as you see, the topic of today is health maintenance, and we're talking about overall health maintenance. And our guest is Dr. Sophia Brown, DNP. And I would just want to read. I love her quote, which says, "I wake up every day doing what I love, enthusiastic about helping and changing my patients' lives for the better, so that they can live a longer, healthier, and more satisfying life for themselves, their families, and friends." And I absolutely love that, because a lot of us know, and some of us have experienced, the medical field has changed. And people may not be as serious with their job, but there's a reason. I'll tell when she comes in. I'm going to tell you why I have her specifically. All right, so Dr. Sophia Angela Brown is a board certified nurse practitioner and a doctor in family health, ranging in ages from infants to the elderly. She specializes in primary care and urgent care, as well as internal family and emergency medicine. Dr. Sophia Brown graduated from Adelphi University, magna cum laude, yes, with a Bachelor of Science in Nursing in 2009. She then attended Downstate Medical Center, where she received honors from the Nursing Honor Society and graduated in 2014 as a family nurse practitioner. She finally graduated in 2020 from Hunter School of Nursing, Sigma Theta Tau, as a doctor of nursing practice. She began working as a nurse practitioner at Interboro Health and Heart Associates in 2015. Dr. Brown has prepared herself to be able to provide safe medical care and has sought to equip herself with the knowledge and connections to be a successful nurse practitioner and doctor of nursing practice. In her desire, to best serve her community and facilitate a different patient experience, absolutely, that embodies both the art and science of medicine with the foundation in nursing, she began her own practice named Family NP Healthcare Services. Dr. Brown's primary desire is to better the lives of her patients through effective, efficient, and empathetic healthcare for all that come through her doors. And I have to tell you, let's just bring her to the stage really quickly. So we are going to bring her on. Yay!
Hi.
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 How are you?
I'm good. How are you? Thank you for having me on your show.
Oh, you are
It's
so
a
welcome.
pleasure and an honor to be here today.
Thank you. This is long overdue. I'll just put it like that. But everything happens when it's supposed to. I'll just put it that way. Listen, first of all, I'm going to brag on you for a minute. For a minute. So, first of all, let me just let you guys know that this is the doctor that I worked for and will still do because I work from home now. But what I love about her is that like I mentioned before, I've had my issues with medicine, with the healthcare field, and I have to say that she is one that has, given me a different perspective in a positive way. Because of working there, she's now my doctor. So, and I'm not just saying for the convenience, but because I actually see how she cares for her patients. And when I say cares for her patients, I mean she will like just keep going and going and going. I ended up having to make a break for her at the office. Okay. And when I tell you, like, she seldom takes the break, I used to have to go back to the office. Did you eat yet? Did you eat yet? No, I'm going to eat. Did you eat? No, I'm just going to see these two patients and then some more coming. Did you eat? No, but by the end of the day, I have to set her down. Like, will you eat, please? Because we can't have you passing out here. I can't help you. So, I mean, she cares that much about her patients. Not even that, but she, put a system up where like we kind of like around the clock, you know what I mean? Like, I mean, yes, we do have hours that, we have office hours. However, on days that the office is closed, we have people like myself and others that are calling patients that have called, and even sometimes she'll do telehealth. I'm telling you, like, when I tell you she cares for her patients, she actually cares for the health and well-being of her patients. And I've witnessed it myself and am a recipient of it. So
Thank you for that, Roberta.
that's why I'm
I'm honored. I'm honored.
I give honor where honor is due.
Thank you.
Honestly. So let's get started. So just before we go into all the questions, tell us a little bit about yourself that's not in your bio.
Okay, so I guess that's coming from more of a personal versus a professional standpoint.
Okay.
Um, so what I love to do, my hobby is skating. It's a big part of my life. It's an actual outlet for me. So I love to do that. So even if you see like she has some handles going across the bottom, you'll see skating DNP because that is exactly what I am. Also, I've been married for going on 10 years by next month, and I have two children,
Yay.
7 and 5. They give me, but it's nice. It's good. It's good. It's good. They're doing well. Um, I'm definitely a people person. I'm definitely a person that likes to have interpersonal relationships with people, always from it's a professional. So it's always a personal touch with a professional relationship. That's been my slogan from the beginning. It's always that personal touch to where people feel that you could be a family member of mine. You could be a person that I can talk to even about anything. And although I may not be able to help with everything, I will know where to send you, where to refer you, where to reach out to a team, because this is what it is in life. It's always going to be a team approach to everything. It's not going to be any isolated person that can handle everything. It's a team approach. So when you have someone that, and in the beginning you were talking about just people being uncomfortable in the medical field, right? When you build a team that is there for your health, there for your well being, there for your mental, emotional state, it's good. And it may not be, again, that one person, but knowing how to have an all around wellness is the key to living a longer and healthier life.
I agree, absolutely. And what I witnessed working in her office, which is in Flushing, Queens, by the way, um, there are like when she has it named perfectly, perfectly. That aspect of family is felt as soon as you walk in the doors. There's always, even with the staff that I work with, there's a lot of diversity there that I really, really enjoy. And even now, I like to keep up, in the meetings and things. I miss coming to the office, and I don't miss the commute. I don't
We
miss the
miss you
commute,
though, so we
but
do miss you.
I, and it's interesting for me to even say that because, like I said, it's not a passion of mine, but I enjoy just being there so much and the camaraderie. So I can just talk about that all day. But it's very, very important that people are able to tell, that you care for their whole, their, because you didn't just say their physical body, that you care about they want a people want a doctor that cares about their emotional well-being, about their nutrition, about their mental state. All of that is important. And I'm so glad that you're able to represent those who, the I'm not going to say that. You're here to represent those that are still taking their job and as a passion, that are there because they're passionate about it. So let's dig in. So let me ask you, what was it that sparked your interest in the medical field from John?
Well, my mom, she's a registered nurse. She was a registered nurse for over like 32 years. She worked in the NICU. Um, always in the baby. So when I first was growing up, I was like, "You in the NICU? You feeding all these babies?" I thought I was gonna have like a million kids, by the way, because of her being there and just seeing how cute they were and their bottle feeding baby. Yes, the babies were sick. You don't take. I'm not taking that away from. It's a hard unit to be a part of, for sure. But as a young person growing up, when I was like trying to decide what my career path would be, I saw um I saw the staff there feeding babies. And and I was like, "Oh, I could do this. This is beautiful. I could do this." And so that just being in the nursing fields from that perspective is what sparked. Now, I've never worked in NICU before, but it always that's what sparked my interest. That's what sparked my passion. And from there, it was honestly just an easy road just to get into the schools that I needed to go to. It was just as if God had his hand on it, that every step that I took was just, there were no walls set up. There was nothing. The schools that I had applied to, I was able to get into them. There were no backups either. So
Wow.
it was like God had his hand on every single step that I had taken from when I got my first job in nursing and everything. It was definitely ordained. It was definitely a step that God had for me. My steps were ordained in that way.
I would agree with that because this is when it comes to everything and anything, when it's a calling of yours, it's a passion of yours. And that's when you're in that and you're operating in that, that's when you do your best. You know what I mean? I feel like that's when you're able to do your job well, best. I'll put it like that. And the people that you're surrounded with, that you're caring for, that you're working with, they're able to tell. And
Right.
that's so much of a difference.
And the doors just start opening for you. Like honestly, the doors are just open for you. It's amazing how you just see God work in that manner. Like, the doors just open. There's no red tape, there's no red lines. You may have your challenges. That will always be the case when you're working on something that's worth it. But definitely, God has opened the doors to let me know that this is where you need to be. And it's been an easy road. It's been enjoyable. And they always say if you enjoy and love what you do, you never work a day in your life.
In your life. Yep.
Yeah.
Yep. That's one of the things that I try to keep with me because that's I honestly feel like that. I've been thinking about that since for years that the best work is the work that you love.
Yes.
And when
Yes.
you're doing that, not only is it, better for your overall health, because when when you wake up in the morning and don't want to do, go to jobs that you don't want to go to, it's stressful.
It is
And,
stressful.
stress is a, that can play a part in your health.
Right.
So not only are you able to do your job better, to, have a healthier state of life, quality of life, but you're able to, you know, enjoy what you're doing. And when you enjoy what you're doing, you actually put your best foot forward. And when you put your best foot forward, your anybody who you come in contact with, those, like I said, those who your colleagues or your patients in your case, or your customers or your clients, they are all able to be recipients of that.
Yes. And they can
And
feel it. They know when you're coming to work for a paycheck versus you actually caring about them. Definitely
exactly.
do know. Yes.
Exactly. My cousin Carlene says, well, shout out to everybody who's here. Hi, Lady Rain. Hi, Carlene. And everybody else. I know my mom's got to be here somewhere. She always is. But yes, y'all leave your comments. But that's such an important thing that I want people to grasp as a whole, for this show as a whole. If you don't get nothing else out of anything that I've ever done, do what you love. Do
Yes.
your whatever your passion is. Go for it. Start. Do whatever it is that it takes. Take the smallest step if you have to. Whatever it is that you can do. And like Dr. Brown said, that God will lead the rest of the way. Like the doors will just open for
And I
you.
always say, just as a point to that as well, just a quick point, sometimes people feel like you may be too old to get into what you love, to do what you love. But when you actually think about our lifespan and where you will be retiring, if you have 10 years, 10 years is a long time to be in the 20 years, 30 years, it's a long time when you really think about it, loving a profession or doing a profession. So if you start at 30, if you start at 40 and you're not planning to retire to 65, you
Mm,
have 20, 30 years to enjoy exactly what you're doing and to get some fulfillment. You do what what makes it, yes, like somebody said, do what you love and love what you do.
exactly. Exactly. I love it. I love it. We're getting to the good stuff already. So let me ask you, what would you say is a major difference between being a nurse practitioner and an MD? And the reason why I'm asking that is because there are some who kind of like, and I've I've seen it, and it kind of now that I know, now that I actually have like been working with you and seeing and hearing people saying, well, she's not a doctor or they're not a doctor, they're just a nurse practitioner. I felt away. I feel away now because I'm like, if you really, but what is the actual difference? What would you say?
So I would say that the difference would be the schooling, right? So the schooling is a little bit different for, and I don't take anything away from the MDs, but in primary care and when you're the front line, and whether you're in the hospital as nurses or whether we're out here in the field owning our practices or being in the outpatient setting, we are the first line. So in the hospitals, when you have the first line, you will have the the knowledge of the nurses that are at the bedside that are dealing with you almost 100% of the time, right? You will have the expertise of the MDs that will allow, or the nurse practitioners, because if you go to the hospital, you go to the ER or something, you have the nurse practitioners that are there. The medical field has always been dominated and by MDs. It's always been them. The umbrella to which the NPs now come under and the advancement in the professions have allowed patients' lives to be taken care of, have allowed health promotion to go on, which has always been the case from the nursing standpoint, right? We've always been into health your well-being, your overall. So when you have these MDs, they have where they deal with the part of the human body. They'll deal with the arm, they'll deal with the leg, they'll deal with, you know, the ankle. As the nurse practitioner, as the nurse, we'll deal with those things as well, but we also encompass what is your degree of functionality and your quality of life once you are able to do things on your own, or when you're not able to do things on your own, what is the quality of life that you'll be able to have? So it's the entire person that we kind of deal with. Now, in some states, there are supervisory roles that are required. We do, when we start off, we have a supervisory requirement that we're able to do 2 3 years, and then we're able to function independently. In primary care, we are we have been trained and drilled and made sure that we have been um, equipped and prepped in order to deliver safe care, deliver high quality care. And because it comes from a place of the art and the science of um, medical field of the medicine, it allows us to embody everything. The medical part, the so that's the science part, and the art is just the entire human being. However, let me say this: we do not work independently. No one works independently. If you have a team of MDs working together, they do not know everything, and they do reach out to their colleagues who have the expertise in whether it be cardiology, whether it be neurology, whether it be urology. They don't do it all on their own, and none of us do, and none of us should. And that's why I said from the beginning, none of us should feel like we're isolated to do anything on our own. It is a team effort when you're taking care of a human being that has several parts of them, right? Everyone has several parts, whether we're talking about the parts of the body physically or the parts of the body with the mental. If I, as a nurse practitioner, a doctor, whatever, come to you and you say, listen, I'm having I'm having issues with sleep, I'm having issues with this, I may be able to be that gatekeeper for you, to tell you where to go, to tell you how to do certain things and give you my expertise. There's many patients that I have, they'll go to the specialist and then come back to me for me to give them an explanation of everything that they just heard from the specialist, right? And I'm like, wait, you just talked to your doctor. Did you
Right.
ask the questions? No, I didn't ask them, or I asked them and they were too rushy. They didn't want to explain to me the way that you sit down and you explain to me, the way that you break it down. And essentially, when we're talking about people, nobody is dumb. Everybody is either educating themselves about their health and their wellness on their own, or they're doing research that allows them to come to the table with something and have a conversation.
Right.
So when we talk about, and I don't want to stray too far from the question that you asked, when you talk about the MD or the NP, we all have an expertise in which we function, right? It doesn't take away from a person who's a clinical psychologist or a physical therapist who's a doctor. We all have a profession in which we study to be at the highest level so that we can deliver safe care to our patients. So what it is a team collaboration. There is no um big and little, and we give the MDs, if I need assistance from an MD because they're the specialist in something, I give that to them. I will refer my patients to them and they'll see it, but you send me back my patients because I need to take care of my patients.
Right. Right. And then they're able to only do it. That's why specialists are specialists. And that's why primary care doctors are necessary. And
Right.
at the end
And
of go ahead.
sorry, and when you talk about primary care specialists or providers, nurse practitioners being trained to be that has opened up the door for there to be a lot more access to healthcare, because we're willing, we're here in the front lines again, being the gatekeepers for patients to know, okay, here we are, this is what we're going to be taking care of, and then I'll send you here to this specialist if need be, depending on what it is. We'll take care of as much as we can within the primary care setting, but when it comes to the fact that you need a specialist, we'll do that.
And that's why we're having this conversation, because it's we don't like to wait. It's well, no, we a lot of us can wait until we've gotten to a point where something is really really wrong, and whether it's an emergency, or we'll let go of we'll let symptoms and things go by, and but when you are you know seeing your doctor regularly, when you're seeing your doctor regularly, like annual physicals and things like of the such, then you're able to catch things quicker.
Right. You can spot things earlier and address them to where you may not even need a specialist. It can stay at that level where you're seeing that gatekeeper who's helping to enhance your well-being overall, unless there is something that I've had patients who I've handled, say for instance, diabetes. And then things are where there are patients who are a lot more fragile. This is just an example of one case, right? They're a lot more fragile. In that case, I'll send them to the specialist. Specialist usually being an endocrinologist. They're dealing with the diabetes, but the minute that the patient is then stable, they'll send them back to me. And honestly, at the same time that they're seeing the specialist, they never stop coming to me,
Hmm.
right? Because we're doing their blood work, we're making sure, and if there's adjustments that need to be made versus on the plan. So now we're both handling this patient at the same time. We're not stepping on each other's toes. And the doctors, that work with us in the primary, they're very respectful of us as the nurse practitioner. Go back to your primary care, she'll do that with you. They're very respectful of that. And again, when you're thinking about the system, the entire medical system, it is always going to be a team effort and a team approach to make sure that a patient is being taken care of all around the board.
Absolutely. So we have a question on the table from the comments. We're going to ask the question really quick, and then we're going to take a really quick break. So Carlin Stevie Wright says, how do you mentally handle your experiences with patients on a daily basis, especially in the case of handling the death? So before you answer that, we're going to take a real quick break, and then we will be right back.
This is the golden mic that everybody loves.
Let's go. Sorry.
I love you, Jesus. I worship and adore you.
Ready and I'm ready. Yeah.
Come over here.
I'm here. You.
Everybody went out mic.
All right, and we are back. So if you're just tuning in, again, welcome to Speaking Plain English. We are talking about health maintenance, and we are here with our guest, Dr. Sophia Brown, who, let me not neglect to say this. I am so sorry, especially since this is Women's History Month. I'll rag you a little bit more. So, first of all, I love the fact that she's a Black doctor that's doing her absolute thing, but her practice, can I say that? Her practice is in the Jewish community. And that in itself is, and like when I say that there's love everywhere and throughout the entire office, we have, patients from all walks of life, from all races, all religions, all, people come from Pennsylvania. I'm like, honestly, people come from Pennsylvania to see her. There is a couple of patients who actually have moved to Georgia and will schedule their annual visits around, when they're coming back, because they don't want to switch doctors. I'm just saying. just so y'all understand who we have. And so we have medical royalty in front of us right here. So I'm saying.
That's too much.
So let's get to the question once again. She says, how do you mentally handle your experiences with patients on a daily basis, especially in the case of handling a death?
So in death, which is always an unfortunate situation that happens in life, there are a lot of emotions that do surround that. So that's where I'm talking about starting off with just assessing a person at where they're at. Do you have the family support that you need? Do you have someone that you can lean on, that you can talk to? Is there a mental health specialist that I would need to refer you to? Right? It's never about, and let's say that you have a death that has occurred. There is no way that you should behave yourself. Let's say that first. There is no right or wrong for the emotions that you have. If you're angry, you have all right to be angry. If you're sad, you have all right. And there's not even a time frame that I can tell you, okay, oh, by now you should be over this. Absolutely not, you know? So that's the first thing of identifying where a person is. When it happened, now, if there's self-harm occurring because of the death, if there's, and I mean, self-harm doesn't mean mutilating yourself or anything like this, just not taking care of yourself, eating well, because of it. Yes, you do have a time frame for that. But when there needs to be an intervention is when your health is now being affected by you having this loss. So a lot of the times I will refer you to a mental health specialist. And we have to understand that the supply and demand of the mental health specialists, they do not meet. So you'll have, because of the pandemic, because of um, a lot of stresses that have happened in people's lives over the last 2, 3 years, okay, because of COVID pandemic, yes, the supply and demand do not meet, but I'm there as a support, right? So I'm making sure your health is good. I'm making sure that you may be following with me. And sometimes I do need to start patients on medication that helps. But again, it's not anything that is pushed on you. We have conversations. So you're coming to me with something and I'm talking to you about it, and then we make a plan going forward then.
I like your approach on that. And the reason why I'm saying it this way is because from what yep, and she just said it. So she was asking how you specifically as a doctor handle it mentally. But before you
Oh,
get
how do
into
I
that,
handle it?
yes,
Okay.
but before you get into
Oh,
that, I'm glad that you said everything that you said because again, that shows that I love how you said that, first of all, there's no way to handle yourself when it comes to grief and when it comes to death. Thank you for saying that. And thank you for making it known that, at some point, some parts of time, that medication may be necessary, but it's a conversation first.
it is a
That
conversation.
it's not something that's pushed on you. So thank you for saying that. So yes, now you can go ahead. How do
How do
you
I deal with it mentally?
yes.
I mean, it's definitely difficult, right? And as a doctor, as a professional in the whether, when I was in the nursing career, um, it is something that is definitely hard. It is something that's hard. But you know that it's life, right? What makes it hard for me the most are the people that are left behind. That's just the honest truth. For me, that's my personal thing. When I see the grief of the family members, that's the hardest part for me because they're living with that. And then, it's the comfort that I'm hoping that they can find in this loss, right? Because again, now when you have like that person is gone, but what does the family have to deal with? How much of the family can still maintain their intactness, right? Who's blaming themselves? Who's feeling guilty? Who's doing so there's so many different emotions, and that's where it's more where I feel emotional about it. I deal with it professionally, of course, but it definitely is something that I'm always in my head wondering how they're doing and what steps can I take to assist them even more than what they have. So that's why I always say, even as their doctor, I have to make sure that they have the mental fortitude. I have to make sure that they have the support system that is able to get them through this hard time.
Absolutely. And that's important for you as a doctor to be able to have your way of dealing. And even that's selfless in itself. You know what I mean? Because yes, you guys have and then Carlene also said, she said my prayers go out to you all. You deal with a lot. You do. Not only even like in with with you're dealing with the physical mainly, but you deal with the body in its totality,
Mhm.
in every aspect of it. So I'm sure that has to be, like she said, it's got to be tough. It's got to be tough,
Mhm.
especially when you are dealing with so many different personalities and so many different cases of where sometimes there are things that just there's nothing that you can do,
Right,
or you've
right.
done all that you were able
Right,
to do,
that you can right, exactly, yes.
and
That was definitely the biggest issue in the pandemic with all of the lives that were lost. I think it was the hardest time. You do have these deaths here and there, but in the last 3 years, it was a lot more in one person's career, right? That you
Mhm.
can say. When you have plagues and pandemics, it does hit you a lot harder because it's just you turn left, you turn right, and it's there. It's a lot.
And especially when you've grown, accustomed, when you kind of built like a rapport with
With
the
the
patient
right,
and
absolutely.
their family, because that's
And
what a
their
lot of
families.
times
Yes, yes, yes.
a lot of them tend to bring their family, and that's why I say like your practice is different. It really is. I go into other doctors' offices for whatever other reasons, and I always, I don't like to compare, but I notice the difference between, just working behind the desk and being a patient myself, and being a patient in other doctors' offices. Like I just have to commend you, honestly.
Thank you.
And I'm getting emotional myself. What is
Thank
going
you.
on?
Oh,
I have to commend you um for being someone who actually really, really takes the patient's life as a whole to heart. You know what I mean? And I mean, there are times, and that's why I understand why, because one thing that she does, like sometimes sometimes we're like, you do too much. Like
you
sometimes
spoil your patients. Everybody, you spoil your
you
patients.
do. I'm like, seriously, she does. And that's why anytime anybody, I don't care where you are, whenever I'm hearing that they have, issues with their doctors and everything, I'm like, are you willing to switch? Because I'm serious. I'm serious because I have yet to meet anyone in your profession that is like you. I
Thank
have to say
you.
that. I
Oh,
have yet to meet anyone in your profession that cares as much as you do. Yes, I have had some other doctors that do their job, and they do enjoy their job, and I can tell that they care, but not at the level that's at this office that you bring. And I just have to say that. What is going on with me? I'm not me trying to tear up a little something.
no, don't do that.
Not that.
Don't do
So
that.
let's move
Let's
on.
go on.
How has your experience been with owning your own practice?
I mean, it's been amazing, to be honest, to be the director and just to build a culture the way that I want the culture to be. And when you say the family, that's what I wanted, a culture of family. Like the patients come through the door. I've had patients ask, why is everybody so happy in here? Why is everybody so chill in here? Like I've had patients like, is this normal? Like why the front desk, from the front desk to the back, everybody is just happy. And it definitely speaks volumes when they're like, not the doctor is the nicest person. When the front desk, and this is why I appreciate my front desk so much, like just the welcoming that they bring to the patients when they walk through the door. You want your experience to be amazing from front to end,
Hmm.
and people like, oh, when I come in here, I feel better already. What was the problem I was coming in here for? I don't remember. I think I'm here for just a wellness check at this point. But just having owning a practice is an amazing experience. It allows me to again guide the culture that I wanted, and just provide the care that I wanted to have for my patients.
Awesome. So a question again. No, I'm going to answer. We said it before. She said, "Where you located?" I'm telling you, Carlene. I'm going to send it to you. She's located 6920 Main Street in Flushing, and if you need, I can get you. I'm serious. I can get you some. I can get you an appointment. Like you need to see her. Honestly, in real talk, you need to see her. And we have a comment on YouTube. I sent a friend to Dr. Brown. The fact that she made it a follow-up call herself on a weekend speaks volumes. Absolutely. And that's what I mean. Like when I say cares for her patients, I mean cares. Like even to the point where she'll make calls on the weekends and will actually like, and I have to ask her sometimes. Sometimes I don't want to ask you if you're taking like, are you doing telehealth today? And I hope you say no. I ask because I have to. But a lot of times I'm like, please say no, because I know you need a break. I've seen the schedule for the week. So, Carlene, I'm telling you, go see her. Go see her. All right. So let me ask you, do you feel like the medical field has changed over the years?
I do, but I'm also young, right? So, uh, over the years, the hospitals, the insurance companies, the managed care professionals have taken over. So a lot of the times when us as the providers feel that our patients may need this or that, it has been limited by what your insurance will cover. It's a big battle with the insurance companies, no matter where you go, whether they'll approve certain procedures, certain medications, things like that. Is your insurance better than her insurance? Is his insurance better than that insurance? What will your insurance pay for? We have to always keep that in mind, unfortunately, right? But what I do, which I don't ever see anybody's insurance from the time they walk through the door, right? I'm giving you and offering you care on the spectrum that you need it, not based on what you can afford, what you can pay for, nothing like that. So, but yes, the politics, the pharmaceutical companies, it does take it out of the hands of the providers in a way to where we have to do. If you ever hear somebody say prior authorizations, we got to fight. We got to fight a lot for you to get a medication that we feel is necessary for you to get imaging that we feel we need to have more knowledge about, a body part or something like that before we're able to continue treatment. It's not working. I need to get this image. We have to fight for that. So yes, it has changed over the years with the managed care regulations.
I got you. Okay, so we are going to take a really quick break one more time, and then we will be, after these messages, we'll be right back. Type of deal.
Are you interested in continuing your education, certificate, or degree that will prepare you in the ministry and equip you in the marketplace? Come make Christ Central University your home. Visit us at www.myccu.online.
Have you ever wanted to host your own inspirational radio show? Have you been called to inspire and spread God's word? Please contact Alicia Rain for more info.
All right, we are back once again, and if you are just tuning in, we are talking about maintaining your health with Dr. Sophia Brown. And all right, so we're going to get into our next question. What would you say are the best ways to take care of your overall health?
This is a big question. This is a question that is a daily conversation. So, number one, preventative measures. You're taking care of your overall health, preventative measures. That's extremely important. Knowing what to avoid, right? Knowing the negative things that we shouldn't be doing. And we all know what we should be doing, what we shouldn't be doing. We all know. We need reminders sometimes. And sometimes you only realize what it is when you come to the doctor's office and we do testing and we see where your cholesterol is at and we see what your blood looks like. And we do sonogram studies to see if there's any plaque buildup. But definitely it's going to be preventative measures such as exercise, dietary habits, no smoking, minimizing the drinking, have fun, but, responsible fun when it comes to your health.
Right. And that's what we call like preventative care.
It is preventative care, yes.
That way, when you come into the office, you have a clean bill of health and you can just make your annuals.
Right. And do your yearly checkups. But also understand that when we look at the modifiable factors that we have, also take a look at your genetics. It is so important to look at your genetics.
Mm.
What mommy has, what daddy has, what grandma had, grandpa has, you have a very, very high chance of acquiring. Therefore, if there is something that you see in them that you can modify your behavior to change from now, now's the time to start working on it to avoid you getting to where they are or just getting to that place at a much later stage.
And that's how can I put it? That's important because a lot of times we don't take into consideration a lot of the things that, like you said, are genetic. And in that, it doesn't necessarily mean that, we're going to get it. You know what I mean? Like if we're, for diabetes and things like that, high blood pressure, that doesn't necessarily mean that we are absolutely going to, but that actually helps to think about, okay, what should I do to make sure, that
You
I
don't
don't,
that you
or
don't
I have a lower chance
right.
of getting
Exactly.
it. Because a lot of times, if we're perfectly honest, and this is speaking from somebody who loves food,
Love is what?
food.
Oh, food.
I tell you, I always tell people when it comes to good food and good music, I'll never see you wrong. So that it actually helps us to understand, okay, if I have diabetes running in my, in my genetics in my family, if this one died of diabetes or this one, it was had high blood pressure or whatever, maybe I should kind of stay away from certain things, or maybe I should make sure, that I'm just watchful. And so it's easier to, when what your family history is, it's easier and it's better to be watchful, or it's wise. I'll put it like that, to be watchful of what it is that either brought them to that point, because, I know as far as type as diabetes specifically goes, there's like two types. There's type A and a type B. One of them is genetics and the other is, it's like that's health
Health wise. Right. Mm-hmm.
So one of those, and again, it's not necessarily saying that they're definitely going to get it, but it just, it
You
kind of
can
makes
do the modifiable. Yes, you can modify your behavior. You can modify your diet, your lifestyle. You could do all lifestyle modifications that can actually prevent you from getting it. Now, there are things that you may do, right? And you try your best and you still have these things that happen. That is true. But it also goes to the fact that people do not like to take medication. I get that. I understand that. You don't want to take medication. Number one, but you also have to be willing to put in the work. You got to be willing to put in the work to prevent you from getting to a place where you need medication.
Right.
You can't sit and do nothing. And then when all of because now you say medication causes side effects, but so do a lot of these comorbidities. Diabetes, hypertension do cause side effects that can change the rest of your life. And if you feel like, oh, well, I've lived my life, I'm 60, I'm 70, and if God takes me now, then it's fine. Yes, that is a good way to think about things, but a lot of times it doesn't happen that way. You suffer through the rest of your life with the comorbidities that you have.
Wow. All right, so we're going to get into the next question. We're actually, I'm going to skip a few because we're running low on time already. I'm telling you, get some good information. But let me ask you this question. Now, do you think holistic methods and modern medicine can work hand in hand?
Absolutely. I absolutely think they can work hand in hand. But you can't be so far gone that the only thing now that you want to do is holistic care.
Ooh, why not?
Because
I see what you mean. I see exactly what you mean. So, like, for example, if somebody is go ahead explain what you mean.
So what I mean is if you want to do holistic measures, do it now with the lifestyle modifications, right? Knowing what your risk factors are, knowing what you have the genetics for. But when your blood pressure is through the roof and your diabetes is that out of control, that can lead you to have your kidneys blown out, or which makes you end up on dialysis, or you can be in a diabetic coma because your sugars are so out of control. Now we're talking about a different thing. Holistic measures at this time is not the time to take. That's not the measures to take at this time. So when you're so far gone It's time for us to intervene with Western medicine because I have seen it work. I do know that it works, but definitely I'm into the holistic. If you want to try, and that's the thing, I'm never a person that will push the medication on you. If you want to say, listen, I want to get it, I want a shot at this. I know my sugar is high, but I want a shot of this. It depends on how high it is. I'll have that conversation with you. And if that's the case, I'll give you 3 months. Do me a favor, make it count. I'll see you back in 3 months and we'll repeat the blood work then.
And I've seen that firsthand. I've not even just, every so often, like and that's one thing that I've noticed is that what she'll say is, see the nutritionist or try diet and exercise or, all of those things. If this is, if it's something that, and that's her suggestion at first, because the first suggestion, I see Dr. Brown as not prescribing medication and things like that unless it's necessary. Unless at this point, it's at the point where it's necessary. Even with like supplements and things like that, I've even matter of fact, you recommended it to me once because I had a cholesterol thing. And instead of going straight to what is it?
The pharmaceuticals, right?
Like the pharmaceutical, she said, look for red yeast rice.
Mm-hmm.
And that actually helped a lot.
Mm-hmm.
And it's a natural, it's natural. So
herbal supplement, yes, to help bring the cholesterol down.
That's why I really, really appreciate, and that's why I'm just going on and on. I appreciate doctors who do that, who are able to, I'm not going to prescribe it for you. I'm not going to recommend this to you unless there is nothing else. And that's what we need more of. All right. So we have just a few minutes left. So let me ask you before we go, because you've given us so much information already, and you've given us a lot of insight on the behind on your side. And I mean, like I said, I greatly appreciate you, and I'm so glad that you were able to take the time to sit with us.
I appreciate you for having me again.
Absolutely. So first of all, what I'm going to do is information on the I already did. Did I? Sure did. So her information is scrolling on the bottom. So if you want to reach out to her, if you want to set up an appointment, if you want to drop something in her Cash App just because, then you can do that. But before we close the show, I want to ask you if you can just give us, our viewers just some words of encouragement in regards to, being sure that they make their health a priority.
So making your health a priority is extremely important. Why? Because it's less suffering, less issues later on down the road. And again, it's not more about, what will happen will happen. A lot of times I try to have people understand that what will happen may not cause it to be just quick. People like to work. Health is wealth. They always say health is wealth, money in the bank, right? So if you can keep yourself working and healthy for as long as possible, you can be around for your family. You can be around for your friends, to enjoy life, to do things, to work, to from the beginning of the show when you said doing what you love. You have time to do that, right? We don't want patients to have long courses of hospitalizations where now you're getting every medication in the book because there were things that we could have taken care of on the outpatient basis. And now we're having to do all of these extensive measures that are unnecessary. So you go in with no medication because you've never got to checked by the doctor. And now you go into the hospital and you're leaving discharged on 7 pills, So it's just about taking care of yourself so you can just live the most effective and the most fruitful life that you can. And that's fruitful in everything, whether you're using your mind or, your health, your emotions to give to other people, you're enhancing others. So take care of your health so that your quality of life can just be up here.
And that's what we need. That's important because like she was saying, you can't be your best and you can't, and even in your own work, you know what I mean? And I'm talking to the viewers and I'm talking to me too, trust me. Even in whatever it is that we do, whenever it is that we're working at, whatever it is that we enjoy, we can do it so much better in a healthy way if our bodies are healthy. Because if our bodies are healthy, our mind is clearer. And if our mind is clearer, then there's, all the things that we need to. There's nothing really stopping us from doing what it is that we want to do, and that what we need to do.
Right.
And in case in point, that's what you were saying. That actually helps with bettering our quality of life and improving our quality of life. And that's why we're here, because we're only here but for the time that we're here for.
Right.
So why not make that time count? You know what I mean? And why not do what, like I've been saying, do what you love. And the best way to do what you love is to do it with a healthy body.
And,
okay,
and to my last analogy, which I love to give my patients, like we drive around these cars, and these cars are all metal pieces and everything like that. Sometimes we put more effort into the vehicle. We'll take it for oil changes. We'll do, as the car gets older, we do a lot more for the car than we spend time on our bodies. And we can't do stuff like that. Like, as the years go by, our organs are also getting older. We're metabolizing and excreting things differently. So definitely it's important for the amount of time, all those who drive and all of that, for those amount of time that you take your car to be serviced every 3 months for an oil change, start thinking about enhancing your life and your quality of life so that when you leave the office, there's nothing else that you have to worry about. Like, I'm good. All right, I'll see her in another 3 months. So, spend time on yourself. Invest in yourself is just so important for the best quality of life you can take.
Absolutely. And one more thing that just came to mind was, like you said, invest in your health. A lot of times I say it like this. I say it's sometimes you have a choice. You can either pay for prevention or pay for a cure. Either way, you're paying. You're spending the time one way or another. So sometimes, yes, some of the things that we may want to do to keep ourselves healthy, even with the food that we eat. It may cost us a little more, but at the end of the day, what we want something that will help, keep us here longer and help us functioning better day by day, instead of having to worry about, paying for procedures and things that actually have to happen. So this was so good. This was so good. And we have one more comment. She says, it's hard to imagine yourself in bad health, but it happens every day. It absolutely does, because a lot of people say, it won't happen to me. It won't happen to me. And in fact, it can.
And it can. So get yourself a primary care provider so we can pick up on it very early. So we don't have to, you don't have to be in bad health. Bad health, it could be a little shaky sometimes based on, again, genetics and things that, you're prone to, but it doesn't have to be bad health. We can get you to the place where your quality of life is amazing and you're able to function. And I always tell people, you wake up, I don't want to take medication. I don't want to do this. If you need it, listen, brush your teeth in the morning, take your pill, doesn't affect your life, but it's working in the background and you can go on with your life and do whatever else you need to do.
So before we go, we do have one more question from YouTube. She says, times are hard for everyone. What do you recommend for people who want to make better changes but are struggling financially?
So it all depends. And that's a conversation, right? Because it all depends on what they're looking for. Always it starts with a conversation. So when you say better changes, it depends on what changes you're looking for. There's always, and everybody's circumstance is different. There is help that can be given to people. So it depends on what your circumstances are, which is a conversation to be had in order to see where you stand and how the resources out there could be beneficial to you.
I hope that answered your question, Annie Plus Ultra. All right, guys, this has been amazing. Once again, thank you for all the feedback that we've gotten. I love it when y'all can talk back to me. I love it. I absolutely love it. Again, thank you, Dr. Brown, for the time that you have taken. This has been another episode of Speaking Plain English. Until next time.
Thank you, Roberta. Thank you. That was good. I love that.
Wait, we're not eating.
I love